The information shared on this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking care because of something you heard on this podcast. The views and opinions expressed by guests or hosts are their own and do not necessarily reflect the official policy or position of any affiliated organizations. Reliance on any information provided by this podcast is solely at your own risk. Welcome back to the Healthy Image Podcast, where we share real stories, real care, and real health journeys. Today's episode is deeply personal because this is a story that hits close to home. Today we're joined by our coworker, Angel Ocasio from Huntington-Hill Breast and Imaging Centers, who is courageously sharing his own open heart surgery journey from the first symptoms he almost brushed off to the moment everything changed, and through the long, humbling road of recovery. Angel is opening up about what this experience truly felt like. Since February's Heart Health Month, we thought we would talk to Angel and walk through his journey together physically, emotionally, and mentally, so patients and families know they're not alone. Welcome, Angel.
Welcome.
Thank you.
We're so excited. We know we really had to pull some teeth trying to get you to come on and tell your story.
Yeah, you did.
We want to give a shout out to your wife.
Yes.
She is the one that convinced you to do this today.
Yeah, she did.
She's a wonderful person.
Yeah, she is.
Well, Angel, for listeners who don't know you yet, what do you do here at Huntington-Hill Imaging and Breast Centers?
Well, my title is application specialist. I handle all the doctors, the radiology, the software that they use to dictate when they're looking at the images that all the patients are coming in for.
Okay.
And when there's issues with it, they contact me and I try and fix it as fast as possible.
So you're known as the fixer.
Sure, let's call it that.
And Angel, how long have you been working here for?
This April will be 10 years.
Wow.
That went by fast.
I know.
Yeah, I did.
Yeah.
That means I've known you my entire career here.
Yeah.
Yeah, you got hired like 6 months before me.
I'm surprised I never scared you away because I feel like I'm always Angel. At the marketing team, we love to contact Angel.
Whenever there's a problem, we're like, oh, Angel's got it. Here's his number. We share it with amongst ourselves.
No, everybody shares my number.
Yeah.
Yeah.
You got to change your number.
Yeah. I've been trying to get rid of my cell phone for a while.
So what originally got you into doing IT work?
Originally I was working at in Boston for Brigham and Women's Hospital and Mass General Hospital when they merged. I was customer service manager. I actually worked in the purchasing area where we purchased all the clinical stuff for the hospital. The Band-Aids, the gauze, the saline solution.
Oh.
And then we went out to the pods, which were the floors, and we would restock them.
Wow.
So I was in charge of collecting. Well, before that, I was in charge of collecting the paperwork and inputting them into a computer.
Yeah.
And then after that, we got handheld devices, but we just went and scanned and
Everything
the
was there.
docking station and everything went away. And that got me interested in computers. And I started going to school for that.
So what would you say is like the most enjoyable part of being in IT? Now.
I know. It's shooting reels and
being in our reels and learning new dance moves.
It's actually figuring out a problem.
Oh.
It's always, something that stumps you. That's been really, really, really ticking you off. And finally, it's either you go to sleep, you wake up, and it's a eureka moment. And you go and you fix it, and it's working, and that's the best feeling.
yeah.
Problem solving.
Yeah. And figuring something out
Yeah.
that felt impossible at one time.
And now, I went 4 years of college, and I went to IT school, and now I take care of the podcast, and all my job is to do this. 4 years, people.
I will say I really enjoy working with you on this podcast because I think you've made my job a little bit easier, making sure
And
this
fun.
works.
And you make it fun. I know you secretly, you threaten to quit every time we ask you to
Yes.
help us on a podcast, but you secretly, look, we got you on.
Yeah, and I
Yeah,
think you love it. I think you secretly love it, and I think you're a very valued member of this team, and we couldn't do this without you.
Yeah.
Let's go with that.
It's on the record. It's recorded.
Yeah.
You
Yeah.
can replay that and show everybody. Stacy said.
This is going to stay on the internet forever.
I know, right?
Yeah.
I'll be immortalized.
So when did you first notice something wasn't right with your health?
And it was towards the end of November after our fall festival that we
Oh,
had
yeah.
here.
Mm-hmm.
And I started getting these chest pains,
Mm.
and I've had anxiety attacks before, so
Mhm.
I thought it was anxiety attacks.
Yeah.
But then I would think, I've been to these sites, I've spoken to these doctors,
Mm-hmm.
I've actually, joked around with these doctors
Yeah.
or radiologists, and why am I being nervous whenever I go to these sites now?
Mm-hmm.
And I would stand still for a little while and take a deep breath, and it would go away. One day I was here at CMBS in the main office, and I had to go outside to get some hardware that I collected from the sites.
Mm-hmm.
And as I walked to the car with an empty cart, I got the chest pain again.
Mm.
And it wasn't painful. It was, like I said, an anxiety attack, like a little pressure.
You felt like anxiety attack in your body, but in your brain, you're like, but I don't feel anxiety.
No.
I'm
Why
not
am I
anxious."
getting this while I'm
Yeah.
going to my car?
Yeah. Was it like an achy pain or what kind of? Can
No,
you describe the
not
pain?
not achy pain. It was I've have asthma and
Yeah.
when it's hard to breathe.
Mm. So it's like a sudden shortness of breath.
Exactly. And right there, Howard was with me, and I said, I'm going to have to go to the doctor. And
Mhm.
I went to the doctor, and they said that I should get a CT scoring
Mm.
done, and which I did, and came out that I was about baseline with what people my age should have.
Yeah.
And nothing happened. I was pretty thrilled.
Mm-hmm.
And but the pain, the feeling continued,
Mm.
and I finally, my wife said, "You need to go to the doctor and find out what's going on."
Yeah.
And being Hispanic, male, Puerto Rican, and being male, basically, we tend to brush everything off, and but if it wasn't for my wife, I wouldn't have gone to the doctor.
Mm-hmm.
Mm.
I thank her for that.
Yeah.
Once I did, they wanted to do a stress test, but it was hard getting one since it was towards the end of the year.
Yeah.
Everybody's on vacation.
Mm-hmm.
And finally got the stress test done. They put me on a treadmill. I did my running. It got hard after a while. And then they rushed me to a table where they did a ultrasound scan.
Mm-hmm.
After that, they said that I needed to get an angio,
Oh.
and which was also hard getting because it was towards the end of the year.
Yeah.
So it ended up being in January.
Okay.
Once that was done, they found out that I had blockage
Oh.
in some of my arteries and in some of the veins in my heart. And nothing was below 50%. In fact, it went higher as you went and as you looked at the picture.
Mm.
50, 99%. And that's where all the issue was coming from.
Yeah.
Wow.
They told me that I needed surgery, and I said, so you're gonna? They hate this phrase, crack you open like an egg.
Mm.
They hate that phrase, so don't use it.
You just did.
I know. But
They need to choose a better choice of words. Is what you're
Yeah.
trying to say.
when I said that,
Yeah.
they said we don't like that. So I went. They said go home. I asked them if I could get a stent. They said no.
Mm.
The way it was, I couldn't do it.
Mm.
So I went home. On the way home, I was still thinking about it. And by the time I got home, I had decided already to do it.
Mhm.
Okay.
And I called them right away, and I said yes. And one of the reasons why wasn't, of course, it was because of my wife, but it was because you hear about all these stars
Yeah.
dropping dead
Mhm.
doing their performance or on stage or
Mhm.
or recording for their show,
Yeah.
and these people have money,
Mhm.
Mhm.
and
All
I
the
would
resources in the
and
world.
I
Yeah.
would s- and I would tell my wife whenever anything happens, if I was them, I would have gone to just to have myself checked out. If I'm constantly on stage
Yeah.
pushing myself
Mhm.
and doing all this, I mean, there must have been something
Yeah.
that happened to them that where they just brushed off.
Mhm.
Um, and that was one of the factors that
Mm.
made me go to the doctor. And
So
get
in
this done.
like this first part of your journey, what was the moment that you realized it was more serious than you thought?
When the anxiety attack became painful lower jaw throbbing,
Oh.
that's when I thought. That's when I said, you know what, this is not good.
Yeah.
Yeah. That's another like warning sign
Yeah,
then.
it is. Usually, it's either up and down your left arm,
Mhm.
or some people actually have back pain.
Oh.
I actually had lower jaw pain.
Wow.
It was like mm, like a like if you had a root canal
Oh.
or
How weird.
yeah.
And you're like not having any problems with your teeth, and
No,
all of
not
a
at all.
sudden
Yeah.
you're
No, all of a
feeling
sudden
this feeling.
it's the whole lower jaw.
Wow.
Do you feel like your role in healthcare influenced how you processed these symptoms?
Well, so I already knew most of the doctors. So as soon as I had my CT scoring test, I called Dr. Wong, who did the reading, and then he told me everything was okay. Dr. Park looked at it. It was, you know,
Mhm.
it was basically, like I said, baseline for what should have been
Yeah.
my age range. Um, but I also knew from experience with people calling me up
Yeah.
because I answer phones
Mhm.
for patient portals,
Mhm.
and usually they're trying to get to their reports to see
Yeah.
what the doctors have said, and most of them are telling me that they've had chest pain, they had the CT scoring also,
Mhm.
and they don't know what's wrong, and listening to these patients, I knew that I needed to get myself checked out.
Yeah.
Mm-hmm.
What role did imaging play for in helping doctors understand like what was going on with your heart?
They were able to see when I had my X-ray done and my CT scoring done. They were able to see if I had any blockage in the major arteries, which I didn't. That's why they were able to decide to go for the angio, because if it wasn't
Mhm.
showing in any of the major parts of the heart,
Yeah.
then it had to be something where you couldn't see.
Yeah. So, as you mentioned, you did the CT calcium scoring first, later needed an angio. And then what was it like getting the final results after the angio? How did that feel?
It was like it was devastating. It was
Yeah.
scary. That's why the first question out of my mouth was, "Can we get stents done?" And they said
Mm.
no, and I just didn't want to get cracked open like an egg.
Hmm. I think when they said, being cracked open like an egg, maybe wrong choice of words, that is something that scares everyone,
Yeah,
because you don't know what to expect. Like
no,
you don't know what's going to happen next. And
no.
that must have been very, very scary for
And I
you.
and I knew that I would have a scar for
Hmm.
the rest of my life.
Yes.
And I mean, I just it was I can't
It
explain
was
the
like a
feeling.
one moment everything was fine, and then the moment results showed that it wasn't fine. It's like
Exactly.
Hmm.
the world changed in one moment.
Yeah.
Yeah.
It just fell right out from under me.
Yeah.
Yeah.
Yeah. But at least you got an answer, like why you were feeling the way you were,
Mhm.
you know, instead of having symptoms and just brushing it off and not getting it checked out. Thank goodness you went in and you knew something was wrong, and thank goodness for your wife making you go get it checked out.
Yeah.
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 So from your own experience, like if someone else, what would you tell someone else if they're going through the similar, symptoms that you're having? What advice would you give them?
Um, if you don't have a wife, listen to your friends, listen to your um, relatives if they tell you to go to the doctor. Listen to that little voice in your head saying that, hey, this is something new.
Yeah.
Go in, have it checked out.
Mm.
Yeah.
You know,
Your gut instinct, if it's telling you something's not right. And if you go to the doctor and they tell you, oh, it's, you have gas, like, at least you know,
Yeah.
and
And
you
it-
can get the worry out of your mind, you
Mhm.
know?
and I understand the thinking for some of these guys out there. You're working hard. You're trying to pay the bills. You don't have time to take time off to
Mhm.
go to the doctor unless you're bleeding to death or your legs hanging partially off. But if there's nothing visibly wrong with you, you just
Yeah.
brush it aside.
Mhm.
Don't do that.
What was the time frame from knowing you needed open heart surgery to getting it done? Was it something they had to do right away, or did...
Well, after the angio and after they read the results,
Mhm.
I did go to the cardiologist, and they told me what needed to be done, and which was in January, and then February 29th, I had the operation.
Mm.
I didn't wait that long.
Yeah.
Yeah. But we had a vacation scheduled, a cruise.
Yeah.
Okay.
Okay, and we did go on the cruise.
Yeah.
Where'd
It
you guys
It
go?
was last week, Mexico.
Okay.
Little cruise around the area.
Mhm.
But we did. It was the last, and that scared my wife as well because sometimes towards the end of the cruise when we were disembarking,
Yeah.
it kind of got a little bit bad there for a while,
Yeah.
Mm.
Yeah.
and that scared her.
Yeah.
Yeah.
And you're on a boat in the middle of the ocean.
No, this is when we actually made it back to
Oh,
California.
okay.
Okay.
At least you were on land.
Yeah.
Yeah.
Or getting close,
So you
close to
can,
land.
if you needed to go see someone, you can.
Right, exactly.
So what was going through your mind the night before your open heart surgery?
Everything,
Mm.
everything. I wrote down. I wrote on a piece of paper a letter to my wife,
Mhm.
No.
giving her instructions how to get to my bank account, how to do this,
Mhm.
how to do that, because
Yeah.
um, just in case I didn't make it, I was prepared.
Yeah.
Yeah.
Preparing for the worst.
Praying
Yeah.
for the worst. I knew that some people didn't make it. We know a coworker who
Mm-hmm.
didn't
Mhm.
make it, and that was actually devastating.
Mm-hmm.
But that happened afterwards. But before that, um, I was prepared. If I didn't make it, I didn't make it.
Mm-hmm.
Mhm.
And during the cruise, when sometimes it got really bad, I would I would say, is it time for this? These are nitroglycerin pills.
Wow.
Mm.
I still carry them with me,
Yeah.
just in case. I don't have to.
Have you needed them since?
No.
Mm. But it's like it's kind of like your safety in case like some of these symptoms were to occur, you know what to do next.
Exactly. The doctors say I don't need them anymore
Yeah.
since I'm on an aspirin regimen.
Yeah.
But
Mhm.
Why not? Why not carry them?
Yeah.
yeah, why not?
Yeah. It's not. It's just a tiny little.
Tiny,
Oh.
tiny, tiny. You could fit in your little coin pocket in your jeans.
Exactly.
Yeah.
So spoiler alert, you did make it.
Yeah.
You made it to the other side
Oh yeah.
in one piece.
Yes.
Just a scar.
But from here to here, yay big.
Wow.
Is it about like 6 inches or how? Like, would you say?
It's the size of my palm.
Hmm.
I've measured it.
Well, now you can wear it as like
Badge of
something.
honor.
Yeah, badge of honor.
It's a shark bite. Like come up with some
Mhm.
crazy story. Got in a sword fight. So, was there anything that surprised you about surgery or the recovery after?
Okay, so the operation took about 12 hours,
Yeah.
which was horrible for my wife.
Hmm.
Horrible for me. I was out.
Yeah.
I was practically dead. No heartbeat.
Mm-hmm.
You were actually just under some good stuff. You
Yeah,
weren't
I was-
aware.
I was I was actually under some excellent drugs.
Yeah, exactly.
Anyway, I woke up. I couldn't open up my eyes. I could
Mm.
hear the people around me.
Mhm.
I had a tube down my throat,
Mhm.
um, which was horrendous.
Yeah.
Yeah.
They started talking to me, and they asked me, "Can you breathe on your own? If you can't breathe on your own, we can't remove the tube."
Mhm.
And I'm like, "Oh hell no! This tube has to come out now." But I couldn't move.
Yeah.
I couldn't open my eyes. I couldn't talk because of the tube.
How interesting. But you were very conscious. You just couldn't.
I couldn't open my eyes. It
Respond.
was a drug.
Yeah.
So I finally mimed a paper and pen,
Okay.
and I wrote down tube clogged.
Yeah.
So I couldn't breathe.
Yeah.
And my wife said, "He wants something to write with."
See, she was there with you the entire
So-
time.
So you couldn't breathe with the tube down
I
your
could.
throat, or it was making it harder to breathe.
It was making it harder to breathe.
Once if they took it out, it would have been an easier.
Right.
Yeah.
At least you can speak at that point.
No, I couldn't speak.
Yeah, because the tube was down your throat. So how could you have,
I couldn't do
made up
anything.
words?
So
Oh.
I wrote down tube clogged,
Yeah.
and they sent something down which was horrible.
Yeah.
Ooh. Yeah.
And then I could breathe on my own, and they pulled the tube out, and I was like, "Thank you."
Mm-hmm.
After that, I didn't feel any pain as of yet. Side note: before the operation, my wife prepared for everything.
Okay.
She purchased these pillows where I would be able to recline.
Mhm.
They said that I needed to, sit up.
Yeah.
I couldn't lie down or sleep on my side. She purchased this apparatus that would keep my ribs in place, so that way I wouldn't be able to, jostle or anything
Yeah.
like that.
It's like a garment. Is it like a garment that you put on?
It was more like a
Like a brace.
brace, yeah.
Mm.
And then she also purchased some shirts where you wouldn't have to lift your arms up. You could just button them around your body.
Oh.
Yeah. So, and I didn't feel any pain. And when they were getting me ready to move from the one room to the other, this nurse hit me on the side, and that was the most. I didn't feel any pain until then,
Oh no.
and I started to cry out loud, and they sprayed something on me, and the pain went away. When I made it to the room, he hit me again. This time I said,
Oh my god.
I asked him, "Did I kill your puppy? I mean,
Why do you hate me so much?
Is that what you're hitting me? Like, kill your puppy? I mean, talk to me, man. I mean, say something. If you hate me so much, let me know." So during recovery, they offered. They kept on coming in and asking me for if I needed any medications, like
Yeah.
really strong stuff.
Mhm.
Believe it or not, all I had was aspirin. I
Good.
didn't need any of the heavy stuff, and I
Mhm.
was pretty much shocked.
Mm-hmm.
Mobility was excellent. I could
Mhm.
raise my arms. I felt no pain.
Mhm.
And this was after the good drugs wore off. A lot of friends came to visit me.
Mhm.
I think partly why I was treated nicely
Yeah.
was because some of the doctors came to visit me.
Aw.
Mm.
Right? Yeah. I got to shout out to a few of them. They and some, like I said, some of my coworkers came to visit me.
Mm-hmm.
But no, recovery was not what I expected.
Mm.
I mean, most of the time it is painful because
Yeah.
you've been sliced and diced.
Yeah.
Yeah.
Your chest's been cracked open,
Yeah.
and you should be in a lot of pain. But unless I actually bumped into something,
Yeah.
I was pretty much okay. I can raise my arm.
Wow.
I can. You're not supposed to drive, people, after the surgery. Reason being, if you get into an accident
Oh.
and the airbag deploys,
Yeah.
your chest is going to become
Oh.
jelly again.
Yeah.
And so
But
I
how
don't want
long?
that to happen.
But how long before after surgery you can drive? Like Is there a
What's the
time
Like a
frame?
month,
recovery?
Yeah.
maybe.
So when did you drive after surgery?
I refuse to answer that question on the grounds it might incriminate me.
He pleads the fifth on that one.
But just make sure you wait a month, you guys.
Whatever your doctor tells you.
Yes, whatever.
Follow doctor's orders.
Yes.
I was driving.
But I would be scared to even be a
The next
passenger in the
day.
car if that's the case. Like, because airbags can go off anywhere. And you have I'm sure doctor's appointments you had to go to.
Yeah.
Like, you had to be in the car.
So I was in the back most of the time.
Yeah, just
Yeah.
throw them in the trunk.
You're being chauffeured around.
Exactly, most of the time.
Yeah.
Yeah.
No, for me, recovery was excellent. I had no problems whatsoever
Yeah.
during recovery. The only thing I did, which I didn't feel
Mm-hmm.
that happened, was I had a lung collapse.
Oh,
And you didn't feel it?
I didn't feel it.
wow.
They had to put the tubes back in to inflate it again.
Yeah.
Was that during surgery or
No, this
after?
was afterwards.
Weird.
Oh.
I
How
didn't-
many days after? Was it immediately after? Or were you
No,
in the
this was
hospital?
maybe 2 days, 3 days
Oh, okay.
afterwards.
That's
While you were
weird.
still in the hospital
I was
then.
still in the hospital.
Oh.
I had lung collapse during my operation, where they did the angio on the arm.
Mm-hmm.
They were going to take that artery,
Okay.
but it had a blood clot in it.
Mm.
They couldn't use it,
Oh,
so they
mm,
took the one in my leg.
Okay.
Yeah, lucky they went there first because that could have
Yeah.
been nasty after
Yeah.
a while.
Mm-hmm.
So, since your open heart surgery and then recovery, now, do you feel a difference? Like, do you feel better than you did before? Not realizing that you were having these issues going on.
Yeah, the shortness of breath is no longer there,
Mm.
which was evident whenever I went out to work or
And
went to
why did
site.
you think you had shortness of breath?
I thought it was my asthma acting up.
Yeah, you
Oh.
always had
Right.
you justified it in your head.
Yeah.
My asthma acting up, so I would, stop for a little while and continue
Mhm.
on. It wasn't, it didn't reach the anxiety attack until way later.
Yeah.
Right.
But no, it started gradually. It was
Mm.
like it snuck up.
Mhm.
It's like a lot of warning signs, like your body was telling you something, but because you were so used to like having asthma and different things, you were like brushing it off.
Right.
Yeah. So just be very aware of what's really going on with your body.
Yeah. Listen to your body
Yeah.
and your loved ones if they tell you to go to
Mhm.
the doctor.
Yeah.
Yeah.
Especially.
Yeah. Yeah. Let the doctor tell you it's nothing.
Yeah. So you can get that peace of mind.
How did the care team help you feel safe during this really vulnerable, scary time?
Oh, they were excellent. They took care of me. They
Mhm.
they they explained everything they were doing at the time they were doing it.
Yeah.
I have to compliment the people at Huntington Hospital. They
Yeah.
were very excellent. The nurses, the everybody was there. I mean, even the people who would come in and clean,
Yeah.
they were excellent. And we would talk, and they would just they made a whole process better.
Yeah.
That's really good to hear.
It's like you're scared and they're coming in, and even if like the cleaning people coming in, just being able to be friendly and joking like that
Mhm.
can help you feel better.
Right.
Even if they're
Yeah.
not talking about what you're going through.
Yeah.
Mhm.
It's just their demeanor and
Yeah, I feel like people in the healthcare, field, it's truly about how they make you feel in those moments because recovery is just, that's on you. But how people make you feel, you'll always remember
Mhm.
from like the doctors to the nurses to everyone that you were encountered with. Like how they make you feel in that moment truly does matter. We did mention how recovery was like. How was your emotional state or how were you feeling mentally? Because we know you were feeling physically well after surgery, but emotionally and mentally, how are you feeling?
When you're getting ready to have this operation, they actually talk to you about this. They said you could go either two ways. You can after the operation you can become a recluse and be afraid to do anything and everything,
Mhm.
Mm,
or you can go and tell this is not going to be what defines you.
Mhm.
You're
Yeah.
going to move forward, do everything you used to do. And I decided to not go the recluse way.
Yeah.
mm,
To live life.
To live life.
You were given a second chance.
Exactly like one of my coworkers says I got a new piping, so I can live longer.
So, what part of healing do people not talk about then?
Okay, so um, like I said, I didn't experience much pain, so I couldn't
Yeah.
speak about that.
Yeah.
But the coughing, they don't talk about the coughing. The
Oh.
coughing, it is horrible, day and night,
Oh
and there's
no.
nothing you can do to stop it. You
Mm.
can take cough drops. You can, they'll 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 recommend certain things,
Mm-hmm.
but what they recommend no longer supplied, and you have to go to like over the counter stuff, and
Mm.
sometimes that doesn't work as well either.
Mm.
It stops the coughing for a little while,
Mm-hmm.
but it's constant. It's
Oh.
about a good 2.5 months of coughing.
And did that hurt
Oh,
your incision and everything?
it was horrendous. The
Mm.
coughing, and then
Oh, I can't
having
imagine
to
that.
have your ribs move around.
You probably just had to like brace
Well,
for it, huh?
they give you a pillow, a heart-shaped pillow,
Uh-huh.
Oh.
where you're supposed to hug
Okay.
and cough when you and hold it as you cough.
Okay.
So
Do you still have that pillow?
yes, I still have that pillow.
Aw.
Do you wish you brought it with you everywhere?
No, but they also one of my coworkers gave me a when I drive, there's this little cushion
Okay.
that goes along the seatbelt
Mm.
that prevents from the seatbelt from rubbing into
Oh, your
Oh.
incision
the
and
scar and everything,
okay.
which I still use because it's um I have wires in here,
Mm-hmm.
wires that I thought were gonna probably set off whenever I go through one of those metal detectors,
Yeah.
Mhm.
and they don't, but it still hurts.
You're like Iron
Mm.
Man.
If you press down against the skin,
Yeah.
it really hurts.
Mm.
Doesn't hurt the ribs anymore, but
Yeah.
anything that presses down on the skin and goes against the cabling.
The cabling. Like that's so crazy to be talking about.
You're
like
like
a bionic man.
Exactly.
It is painful,
Mhm.
Mm.
So that helps kind
and
of
also
ease
the
that.
itching.
Oh, the itching.
The itching. Stacy knows about the itching. She says she has recommended stuff and given
Yeah.
me lotions, but
You think
Did
that
it
helped?
work?
they work for a while.
Yeah.
But it continues. If you
Oh.
walk past my cubicle and you see me going like this,
Mm-hmm.
you know what's going on. I can't
You can't.
scratch directly on the scarf, but
Mm-hmm.
because once again it hurts.
Yeah.
So I scratch around it.
So, because of this experience, how do you think, you view life? How do you think you approach like work now based off of having open heart surgery?
Okay, so whenever I wake up in the morning, I'm thankful that I wake up,
Mm-hmm.
that I'm waking up,
Mhm.
Yeah.
because you never know. As it is, um, I go to sleep earlier than my wife does. She stays outside in the living room while I'm sleeping, and because I wake up at 5 o'clock
Mm.
and I'm here by 6,
Yeah.
6:30. My wife, she now I hear her come into the bedroom
Mm.
to do whatever, or get something or whatever,
Yeah.
and she stands there for a little while. I guess you know how when you have a
Yeah.
newborn and you
Yeah.
make sure that they're still breathing.
Yeah.
Yeah.
That's what she does with me. She makes.
But it's sweet. It's like it's in a way it's like sweet and care,
Mm,
If she didn't stand there, then you did something wrong.
Have you ever
Right.
woken up and just seen her standing there?
no, no, I pretend that I'm sleeping.
Okay.
I can continue on. 'Cause
You'll actually take some deep breaths to make sure she knows.
I know. I actually move.
Okay.
I move my hand.
Good.
And so I
Good.
You're
flip
like,
to the
I'm
other side.
good.
So
That's funny.
if I move, she goes out.
Yeah.
Okay.
During recovery, what I'm thankful for also is that that I took care of this operation before I had a heart attack, an actual heart
Yeah.
attack.
Mhm.
Because during the time where I was getting my piece of paper to get um, come back to work,
Yeah.
I was sitting there in the waiting room, and another person was wheeled in a wheelchair,
Yeah.
and he had his operation,
Mm-hmm.
but he had a heart attack before the operation, and he wasn't in any way shape, or form ready to go back to work.
Yeah.
And he had his operation before I did.
Wow.
When the person came out with the paper to say that I could go back to work,
Yeah.
they gave it to the other person in the wheelchair. She goes, "So Angel, here we're going to keep this. We're going to keep this, a copy of this in our files, and this one you can give to your work so you can return back to work." And the guy was drooling.
Oh no.
Okay. And I have raised my hand and said, "I'm Angel," and she looked at me and said,
Shocked that you were able to go back.
Yeah.
And I looked and I said, "Yeah, I don't look like I had open heart surgery, do I?" Because I didn't.
Yeah. You were one of the luckier ones then.
Well, and like you said, you didn't wait till a heart
Yeah.
attack happened.
Right.
You listened. Well,
Yeah.
your wife listened to your symptoms.
Yeah. And I listened to her.
Yeah,
Yeah.
as you should.
Happy wife, happy life. That's what they say, right?
Exactly.
Exactly. Yeah.
Oh.
So now, back to your question. Now I'm actually, you know how you wait for you to retire, or you have time to go on vacation.
Yeah.
We've decided to go on vacation more now.
Live
Good.
Which
life
we
now.
are. We're that's what we're doing, living life now. I'm careful with what I do, what I eat.
Yeah.
I don't eat snacks as much, only in case of emergencies. But yeah, no, we're going on vacation. I'm eating better now. My wife's cooking more salmon, more fish, more less red meat. So yeah, but dietary change.
That's good.
Yeah.
Are you?
I like though that you're, like you said, living life.
Yeah.
And I feel like that's a good message to the listeners. Even if you don't have any health issues, don't wait. Live your life now. You know, life's too short. You never know. Go on the vacation. Go visit your family.
Yeah.
Live life right now, you know? What is one small joy that you appreciate now that you didn't really appreciate before surgery?
Okay. There's possibly two to that.
Oh, okay.
Hey.
Okay, so first one is, like I said before, waking up now. I took that for granted.
Yeah.
You know, you wake up in the morning. So, you know, you do that all the time.
Yeah.
Now, when you wake up, you're like, all right, another day.
Yeah.
I have a pulse.
I love that though. It's like how great to feel that joy just to wake up. And everybody that's listening to this today, they woke up this morning. And but just think if you felt that joy every single morning. That I love that.
When I was a teenager,
Yeah.
growing up, I used to like drawing. I actually won a little scholarship to the Museum of Fine Arts in Boston, and I used to enjoy drawing.
Yeah.
Before I went into IT, I wanted to actually draw for comic books like Marvel or
Oh,
DC.
that's cool.
And that, and I stopped that because I needed to eat.
Yeah.
And I went into IT. But now I started doodling again, and I'm still
cool.
I'm rusty, but I mean that used to bring a little bit of joy to me when I used to draw, and now I'm getting back into that.
Good.
That's really good. Can we expect to see some of your artwork anytime
know.
soon?
Hell no.
Oh, Angel.
Oh,
Same Angel before surgery, you know. Well, as we wrap up today's episode, we want to thank you, Angel, for your courage and honest and sharing your story and your journey. I know it's been a really powerful reminder that listening to your body, getting checked early, and trusting the process can truly save your life. And at Huntington-Hill Breast and Imaging Centers, we see every day how imaging becomes the first step toward answers, clarity, and healing. Angel, I think your experience is living proof of that. Whether you're a patient, a caregiver, or someone who has been putting off that appointment, let this be your reminder that your health matters and you're never alone in this journey. If this episode helped you, please share it with someone who might need to hear it. And as always, stay curious, stay engaged, and stay healthy. Bye.
Bye.